Dr. Edward Laniewski here at the Orthologic Biologic Institute seminar in Chicago at McCormick Place. And I am here today with one of the leaders in cell-based therapy, Dr. Jack Farr. I call him Jack Farr the superstar because he's been around for quite a while. He's got an honorary degree in biologic engineering. He's also part of the International Cartilage Repair Society, and he's been the vice president of the Patellofemoral Foundation. He's developed 2 different joint replacements and also a meniscus repair system. He's got numerous books. You've published extensively. And the reason why I had you come in here, and I'm so glad that you're here, is because you're going to have a very interesting talk coming up that's going to talk about a randomized control trial comparing a amniotic fluid versus hyaluronic acid. That's like the gel injections that we normally give to patients. And I'm just going to go ahead and let you go ahead and comment about it and how this may change things.
Well, first of all, there's a lot of different so-called amniotic products on the market today. It's a subset of the placental products that have chorion and amnion. So ours is an amniotic product. They a lot of times will differ in how they're processed and then how they're preserved. Some of them are terminally sterilized, some of them are aseptically processed. In this case, this is aseptically processed, and you mentioned amniotic fluid. It's amniotic fluid cells, and the amnion that's been micronized, and then that is combined. So it has both the properties of the amniotic membrane itself as well as the cells. And there's a marked debate. We just saw, several talks that have looked at different products. The product that we're using has not been tested at these facilities. In other words, the work that you saw was elegant and showed no cells. And in fact, the product that we're using, we're really not commenting on what's in the product other than it's got micronized amniotic membrane and the amniotic fluid that does have some cells in it. But we're not typing them. We're certainly not claiming they're meniscal mesenchymal stem cells. These are just amniotic fluid cells, and whether or not they're living, we're not claiming. So pretty basics in what we're stating. So it's amniotic fluid with the cells and the membrane. It's reconstituted in saline, and then it's injected into the joint. And as you said, it's a 1-to-1-to-1 study, so we're comparing HA and saline. Supposedly the HA is sort of the active control and saline's the non-active control, but as several studies have shown, saline has an effect in every study, a positive effect, usually on the order of 30 to even 40% response rate, and that's what we saw. So that was interesting. This is a blinded study, so the patients didn't know what they were getting. At 3 months, we asked them, do you have acceptable pain or unacceptable pain? And if they had unacceptable pain, then we allowed them to cross over into the ASA group, the amniotic suspension allograft. And of those, the number of people who withdraw from the study before that 3-month time frame, because in any study, a patient can disenroll at any point. I mean, there's no restriction. So they were about the same, no statistical difference. But at 3 months, looking at those who had unacceptable pain, there was a statistical difference between the ASA group and the HA and saline. And HA and saline were about the same. And then if you look at our data at 3 months, 6 months, and I'll report 12 months today, it's pretty baseline. Once they reach a plateau, they kind of stay there between 6 months and 12 months. And there is a clinically significant difference, both statistical and clinical, because if you have enough patients, you can get something that's statistically significant, but then you ask a patient, is 2 points different in my score? Is that clinically significant? No. So for different scores, where it's the KOOS, which is obviously accepted in a lot of journals, it's around 8 to 10 points, and in our particular study, I believe it was around 13 points. And then in VAS is somewhere a little higher in the teens for a minimally important difference, and ours was about 30.
Okay.
So pretty significant. And then if you look at the two arms, I was asked this last year, so at say 6 months or 12 months, the difference between, because they both improved, so even saline, as we know, they both improved, but was there a minimally important difference between the ASA and those other two arms? And the answer is yes.
Okay.
So it's food for thought. It's now going to allow us to have a discussion with the FDA. As you know, November 2017, the FDA came out and said, here's your guidance for these products that are non-homologous or manipulated. You're going to have to go through a standard trial, either down a drug route or down a device route. And certainly nobody's trying to say that amniotic membrane is homologous use in the knee. So that's why we're doing this from hopefully a scientifically sound method of looking at it.
Do you plan on actually going to the FDA and ask for an indication then?
No, it's going to, the FDA is not just going to say, oh, nice study. The FDA is going to go, oh, interesting study. I think it shows that it's safe, and it shows that it's suggesting that it's working. Here's what we want you to do to actually go for a biologic license. So I look forward to another RCT.
That's good, but this is the first step, and
Yes.
This is the first one I know of that actually has a randomized controlled trial looking at this that I know of, unless you know of another.
Well, I believe MiMedx has an ongoing trial, but I have not seen it reported.
Yeah, I mean, you're the first one to report.
Right.
Yep. And I was there in San Diego when you had the 6-month data, which was very, very interesting. And to just kind of switch gears a little bit, you've been in this a long period of time, I respect your opinion. What do you think is the most important issue right now in cell therapy so that we can move forward?
Well, it's not just cell therapy, but it's this whole area of cell growth factors, because you have PRP in that, which doesn't have cells. So the biggest problem I see is that we need to be able to talk about the same thing on every paper. So there's so many different parameters. In other words, I just talked about amniotic membrane. Every product out there is a little bit different. So it'd be nice to have some more standardization, both for bone marrow aspirate concentrate, where it's obtained from, and same thing with PRP. As we know, there's high variations, even in yourself, day to day. Whether you go exercise, your PRP is going to be different than if you don't, if it's in the morning or if it's night. So there's a lot of things that you cannot generalize from one topic to another, and I would like to have some more standardization so we can make, when you do these systematic reviews, that actually you can actually review it and compare. So I think that's the big problem. The exciting thing is they do appear in selected instances. They're promising in a lot of areas, but you'd like to go from a promise to this is the reality.
It is a moving target. You brought up a really good point. Our bodies manufacture this, but our bodies change moment to moment of what we need. So like you said, when you're exercising, you're going to need a different set than when you're sleeping. And even throughout the day, because of your diurnal patterns that you have right now, it's going to change. Hormonal changes that you have to get you to sleep and then to wake up, that's going to change the whole mixture. That doesn't happen in a factory. It's standardized. It just keeps producing the exact same thing every single time, but that's not our bodies. It changes, so it is hard to quantify that. But you brought up a really good point. It is promising. It's promising, and we can take that promise back to our patients and say, this is what looks like is happening, and this is what we're hoping is going to happen with you.
I think so that's the promising area. The threat to this whole area of orthobiologics are people that are just operating on promises only, and they're making false claims to patients. Most of the time they're not injuring the patient other than their pocketbook. And I think for some of these elderly patients, I think $5,000 taken out of their retirement account to do, quote, stem cells is not right. So I just hope there's a little bit more self-policing.
Yep, and that's why we're here, and that's why I respect you of taking a scientific approach to this. So in summary today, we talked about how amniotic fluid and amniotic tissue could go ahead and be beneficial compared to a standard treatment that we have. And we were graced by Dr. Jack Farr, who's had a lot of experience here, because we do believe that these are your cells for your healing. Take care.